Which weight loss medicines are approved in the UK and how do you access them safely? This video is for general information only and doesn't replace personalised advice from your GP or pharmacist. Always speak to a registered healthcare professional before starting any treatment. So, are weight loss medicines actually safe? And how do you know which ones are legitimate? Those are great questions. And the answer really depends on where the medicine comes from and whether it's been properly approved for use in the UK. With so many products out there, from NHS prescriptions to supplements sold online, it can be genuinely difficult to know what's safe and what isn't. Understanding the difference could protect your health. In the UK, a weight loss medicine is only considered safe if it's been approved by the MHRA, the Medicines and Healthcare Products Regulatory Agency. They're responsible for making sure medicines used in Great Britain have been through rigorous clinical trials. It's worth noting that in Northern Ireland, medicines authorisations from the European Medicines Agency also apply under the Windsor framework. Before anything gets approved, manufacturers have to submit extensive evidence showing that the benefits outweigh the risks. It's a high bar, and that's a good thing. Once the MHRA approves a medicine, NICE, the National Institute for Health and Care Excellence, then looks at whether it's clinically effective and cost-effective for NHS use, shaping how these medicines get prescribed across England and Wales. So which weight loss medicines are currently approved in the UK? There are three main ones. First, orlistat, brand names Xenical or Ali, which works by reducing how much dietary fat your gut absorbs. Then there are semaglutide, brand name Wegovy, and liraglutide, brand name Saxenda. These both belong to a class called GLP-1 receptor agonists, and it's worth knowing up front, these aren't tablets. They're given as injections. They work by acting on receptors in the brain to reduce appetite and by slowing down how quickly your stomach empties. Each of these medicines has specific eligibility criteria, so not everyone will be suitable for all three. Who might be considered for a prescribed weight loss medicine? It generally comes down to a few factors. Your BMI is one of them, though the thresholds are set lower for certain ethnic groups because research shows health risks can occur at a lower BMI in those populations, whether you have weight-related conditions like type 2 diabetes or high blood pressure also plays a role, and typically you'd need to have already made genuine attempts at lifestyle-based weight loss. And your doctor is the right person to assess what might be appropriate for you. Now, side effects, because it's important to go in with realistic expectations. The most commonly reported ones are gastrointestinal, nausea, changes in bowel habits, digestive discomfort. These tend to be more common when you first start. There are also rarer but more serious risks to be aware of, depending on the medicine. These can include pancreatitis, gallbladder disease, and liver injury. These are uncommon but real, and they're part of why medical supervision matters so much. If you're prescribed one of these medicines, your doctor or pharmacist will talk you through what to watch out for. And in the UK, there's the MHRA yellow card scheme. That's how patients and healthcare professionals report suspected side effects. Reporting anything that concerns you genuinely contributes to ongoing safety monitoring for everyone. One thing that really cannot be stressed enough: only obtain weight loss medication through a GP, a CQC registered clinic, or a GPHC registered pharmacy. Buying from unverified online sources isn't just risky, it's illegal. You have no way of knowing what's actually in those products. It's simply not worth it. And whatever treatment you're on, medication works best alongside sustainable lifestyle changes, a balanced diet, regular physical activity, and ongoing support from a healthcare professional. If you're thinking about whether any of these options might be right for you, start by speaking to your GP. They can look at your full medical history and help you make an informed decision. Got questions? Drop them in the comments below. We read every single one. And if you found this helpful, give it a like and subscribe to the Bolt Pharmacy channel for more medically reviewed health information.